we worry about transfer of power, transfer of responsibility. As far as I'm concerned, the more power that patients have, the better. The more power that individuals have, the better, because they're best placed to decide on what works for them. And to be frank, there's very clear evidence that if people feel powerless, their well-being is greatly reduced. If people feel that they have a degree of power, a degree of autonomy, that actually helps their well-being. So to suggest that it involves something that relates to a loss of power on the part of the service provider in order for the service user to gain, I think is quite wrong. I think the service user, the patient, the carer can have as much power as they're able to exercise without causing any loss or harm to the service provider whatsoever. Indeed, I think it's greatly to the benefit of service providers to have powerful voices and powerful patients and powerful service users who are able to help us to understand what works for them. It's absolutely essential that we hear what people who use our services have to say. And I believe that as people do get involved with it, they'll find that they'll learn things that will be beneficial to them, as well as things that will be beneficial to patients and carers and their families. So I think this wins all round.
Well, I think it's a fantastic opportunity to deliver the changes that we need to make in our health and social care services, not top down, but what I would say is bottom up. And what I mean by that is, for far too long we've had a culture of going into communities and telling them what we're going to do, and we consider that to be consulting with people. I don't think that's ever been a process which I've been comfortable with. And what we're trying to do now is create a process that will allow, instead of going to people with solutions and saying this is what is happening, we go to people with a problem and say these are the problems we're facing, we need to change. How do you think we can work together to make these changes to deliver better, more effective services? I think it's going to need a change in culture. It's going to challenge professionals, because professionals sometimes believe that they know all the answers, when actually the people who are engaging with them perhaps have experiences that they haven't come across before. And these experiences, quite rightly, should shape the services that we're going to look to deliver. So I think it's a case of challenging people to be open, to accept that they have to be transparent, to be accountable. And at the same time, there are great rewards that come from that, because professionals want to deliver the best possible services. They want better for our people, and I think this is a process that's going to challenge them, but have great rewards for them professionally likewise.
I think patients are really at the crux, the heart of the matter. At the end of the day, it's about us as people. Yes, the professionals are also the people and the patients, but I think their voices do need to be heard, because it's about them. They know themselves better than anybody else.